Welcome to my channel, Pharma Knowledge. In this video, we'll explore various respiratory drugs, including expectorants, mucolytics, antitussives, decongestants, and antihistamines, highlighting their roles in managing respiratory disorders. Join us as we break down how these medications work to alleviate symptoms and improve respiratory health. The first class to talk about is expectorants, which are used in the respiratory system to help clear mucus from the airways. The main function of expectorants is to thin the mucus, making it easier to cough up and expel. They work by 1. Increasing mucus production, 2. Facilitate cough reflex, 3. Reduce mucus adhesiveness. Therapeutic uses of expectorants are bronchitis, influenza, COPD, pneumonia, asthma, sinusitis. Examples of expectorants are guaifenesin potassium iodide, ipecacuanha, eucalyptus oil. Side effects are rash, nausea, vomiting, headache, diarrhea, GI upset. Mnemonics of expectorant. Good people inhale effectively. The next class to discuss is MUCOLYTICS, which work by 1. Disrupt disulfide bonds, 2. Alter mucus composition, 3. Stimulate serous secretions. Therapeutic uses of mucolytics are chronic obstructive pulmonary disease, COPD, cystic fibrosis, chronic bronchitis, asthma, bronchiectasis, post-surgery respiratory care, respiratory infections. Side effects of mucolytics are nausea, vomiting, diarrhea, stomach pain, rash. Mnemonics of mucolytics are a calm breath eases airways. Next class is antitussives that suppress or reduce coughing, typically used when coughing is dry and unproductive. They are 2 types. 1. Central-acting antitussives, which act on the brain's cough center in the medulla oblongata, reducing the urge to cough. Peripheral-acting antitussives. These act locally on the airways or lungs by reducing irritation and sensitivity in the respiratory tract. Therapeutic uses of antitussives are in dry, unproductive cough, chronic cough, irritating cough at night. Whooping cough, pertussis. Examples of antitussives are centrally acting antitussives, 1. Opioid antitussives, codeine, hydrocodone, folcodine, non-opioid. Antitussives, dextromethorphan, noscapine, butamirat, clobutanol, clofedienol. 2. Peripherally acting antitussives, benzonatate, levocloparastine, ivy leaf extract, thymol. Herbal natural antitussives are often found in over-the-counter cough remedies, like honey, ivy leaf extract, menthol, thymol. Side effects of antitussives are seen in different groups as seen like drowsiness, dizziness, nausea. Mnemonics of 1. Centrally acting antitussives are doctors help patients calm nasty bronchial coughs, 2. Peripherally acting antitussives are breathe lightly in the cold, 3. Herbal natural antitussives are herbal ingredients make throats happy. Next class to discuss is decongestants, which relieve nasal congestion in conditions like the common cold, allergic rhinitis, and sinusitis. They work by alpha-adrenergic receptor agonism, vasoconstriction, reduced blood flow, reduced mucus production, improved nasal airflow. Therapeutic uses are common cold, allergic rhinitis, hay fever, sinusitis, nasal congestion, eustachian tube dysfunction, preoperative preparation. Important consideration are avoid prolonged use of topical decongestants to prevent rebound congestion. Examples of 1. Systemic oral decongestants are pseudoephedrine, phenylephrine 2. Topical nasal decongestants are oxymetazoline, xylometazoline, nafazoline, phenylephrine, nasal spray 3. Combination products are Claritin D, Zyrtec D, Dayquil. Side effects are increased blood pressure, nervousness, insomnia, dizziness, dryness of mucous membranes, rebound. Congestion, important considerations are, can interact with certain medications, especially MAO inhibitors and other stimulants. Mnemonics of systemic decongestants are please stop coughing. For topical decongestants are open xylophones need playing. Next class is antihistamines, which play a key role in managing respiratory disorders, particularly those associated with allergic reactions. There are two types of antihistamines H1 antihistamines and H2. Antihistamines H1 is further divided into first-generation sedating and second-generation non-sedating. H1 antihistamines, first generation, sedating, works by blocking H1 receptors, reducing allergic symptoms, decrease vascular permeability, and that of second generation, non-sedating, show action by blocking H1 receptors, reducing allergic symptoms. Whereas H2 antihistamines has limited role in respiratory disorders. H1 receptor blockers are used in conditions like allergic rhinitis, common cold, allergic asthma, anaphylaxis, while H2 receptor blockers has limited use in respiratory disorders for adjunctive treatment in anaphylaxis, combined with H1 antihistamines to manage severe allergic reactions. Examples of first-generation sedating are diphenhydramine, chlorpheniramine, hydroxyzine, promethazine, cyclizine. Examples of second-generation are loratadine, cetirizine, fexofenadine, desloratadine. Side effects of first generation are sedation and drowsiness, dry mouth and throat, blurred vision, urinary retention, dizziness and impaired coordination. And that of second-generation non-sedating are minimal sedation, headache, dry mouth, fatigue. Mnemonics of first-generation sedating are dumb cats can't help sleep, and second-generation non-sedating are loyal cats frequently don't. Thanks for watching. Don't forget to like, share and subscribe.